Maybe that should be my theme song. I know many of you are waiting for G's return, but that's coming up tomorrow, so you only have to suffer through another, couple hours of me tonight. I am Raleigh James. This is WGN Radio. Producer Jasmine has lined up some great guests, and as I say, if you try to think about a good... And by the way, that I should mention that's Major Lance, okay, 1964, and we'll talk about Major some other time, I promise, because, man, he's Chicago soul if there ever was any. So, one of the, I hate to say positives, but the silver linings of a pandemic is we can put off those things that normally we'd feel guilt putting off. And is there any better exemplar than the dentist? Well, it turns out that that trip to the dentist is more than just your teeth. And so we're talking to the super dentist, who is Kami Haas in San Diego, and you can check him out at thesuperdentist.com. So Kami, thanks for joining us.
Well, thanks for having me.
I find this interesting because I know several people over the years who have said things like, I had all this great nausea problem, and they were doing all these GI tests, and then they found out they just needed to pull a tooth. And what was amazing to me is people would say this as if they were incredulous, as if this wasn't, knowledge, top of mind awareness. And I'm sure you deal with that all the time, of trying to explain to people, yes, there is a connection to the rest of your body and your teeth.
Yeah, after all, your mouth is connected to your body, right? But Raleigh, before I answer that question, I overheard you saying, your comment earlier about how you're now skipping your dental visits guilt-free. Well, I'm sorry to tell you, but dental offices are reopening, so you're not going to be feeling guilt-free for long, and for a good reason. I'll explain that in just a minute. But you're right. I mean, my own grandmother, when she was in her 20s, she had all of her teeth removed. In fact, when I was growing up, and I always saw that she had dentures on, and I always figured maybe all grandparents have dentures. And when I was about 12 or something, I asked her, "Hey, Grandma, I've noticed like my other friends' grandparents still have their teeth. What happened to your teeth?" And she started crying, and she told me the story about how when she was younger, she had some digestion issues, and she went to all sorts of doctors. They couldn't figure anything out. Eventually, they said they had to pull her teeth. Now, obviously, that was an extreme measure. During 1920s and 30s, there was this common acceptance among the medical community in Europe and the United States that pretty much every medical problem was caused by dental problems. From physical problem to mental problems to all sorts of things. So obviously, the pendulum went from that extreme to the other extreme. In our society now, that we just think, what's the big deal about poor oral health? You just get a cavity, and the dentist can easily fix it. So I think the fact that dentistry and medicine have always been two different disciplines, this has been a really bad thing, and so the result of this has been that poor oral health has impacted so many issues, including lung health, which is so critical during this crisis.
Well, it is, and you're right. I remember, by the way, as a young child, knowing people, because I had autoimmune problems, in the autoimmune community, we're going to pull your teeth, that it just seemed like, we'll try this next, and I always thought that was somewhat draconian. Where did that philosophy even start?
It started from, there was this microbiologist in Germany, Dr. Miller, that basically came up with this theory that, because mouth is really the opening to your body, right?
Of course.
So it's not that far-fetched for them in the late 1900s to think that potentially the mouth is causing a lot of dental health issues. So we went from that extreme to the fact that, hey, everything's caused by the mouth. Now the last 20, 30 years, we've had dozens and dozens of amazing studies linking poor oral health to everything from infertility, pregnancy issues, preterm birth, all sorts of systemic diseases, cardiovascular disease, many types of cancer, and also including lung health, which is really the topic of discussion because of the COVID-19. In fact, I thought it was such a lack of discussion. I think I watch the news like everybody, and the media, the medical community is talking about everything. I think that could be potentially linked to COVID. Obviously how we want to build our immune system, but no one's really discussing the oral health connection. So I just decided to really be a spokesperson for that. I wrote an article that's on our website the superdentist.com/COVID report that your listeners can download complimentary, that I really went through the literature and I really discussed the connection between oral health and lung health as it's connected to everything else in the body. It's needless to say that your mouth is connected to the body and it affects every part of your body when it comes to your health. But unfortunately, because of our medical system and the dental system, the way it's designed right now, people seem to have forgotten that.
You're right. You're discussing one of the flaws of allopathic medicine, where they're not looking at the entire being holistically. And sure, there would be a link. I mean, you would almost know that from one of the first things they tell you: don't touch your mouth, don't touch your nose. I mean, certainly germs can come in that way, but more than coming in that way, there is a huge connection with regard to dental health, if not direct, indirect, through what poor dental health will do to your immunity. So what have you seen in that area?
Yeah, when you think about it, for example, our microbiome, the collection of microbes. And I know right now we're focusing on one particular microbe, this COVID-19 virus, the SARS-CoV-2. And so, but when you think about it, most of our body, we have actually more microbes in our body, when it's collectively called microbiome, than we have human cells. And so a lot of our health is dependent, a lot of our immune system and its function is related to our microbiome. And so our mouth, when it has a good collection of microbiome and the ecosystem is stable and it's wonderful, then it really helps our body fight off a lot of diseases, a lot of bad bacteria, quote unquote, or bad viruses. And COVID-19 is no exception, because it's just another virus that enters the body through the mouth, through the nose, through the eyes. So the way that happens is usually if you have poor oral health, either through a cavity that's deep, that's connected to the pulp, or to bleeding gums, or through the inflammation that's inside the mouth caused by microbes, the bad pathogens. That can either trigger inflammation in the other parts of the body, or the microbes can enter the bloodstream, through the bleeding gums, and then travel to pretty much everywhere, because that's where the blood goes. Wherever the blood goes, and it could go to your heart, it goes to your lungs, to your brain, anywhere that the blood transfers. So from that perspective, from a health perspective, from the fact that when you get a cavity, small cavities can turn into big cavities. Like we've had obviously 2 months of dental closures, dental offices being closed across the country. And when we started this about 2 months ago, we have several locations in San Diego, and we, just to save some PPEs for our physician colleagues and nurses, and to keep the environment more safer for our staff and our doctors, we only opened in a central location to see patients for emergencies. The first few days, the emergencies were, once in a couple of emergencies a day. By now, we have so many emergencies because the small problems have turned into big problems that we're adding more days. We're opening up other locations just to serve our emergencies. Because as you can imagine, cavities don't pause because there's a pandemic. Gum disease doesn't pause because there's a pandemic. Oral development issues don't pause because there's a pandemic. All of these things are constantly getting better because dentists are not there to help patients with those problems.
Well, it's interesting. You're talking about all the things that will cause people to run to the dentist because pain's a great motivator, but there's a number of silent things like plaque that can host respiratory pathogens better than pretty much anything else. And seeing a dentist to handle that is generally not a painful process. But as some of these offices are not yet open and as for some people it's tough to get an appointment, there's stuff people can do at home. What?
That's a great question, and thank you for bringing it up. So obviously, I'm sure the message you've heard every time you go to the dentist, brush and floss. That's probably the most important thing right now to protect your oral health. For patients who have difficulty with brushing and flossing, or they have poor oral health and the brushing and flossing is not enough, and the way you can tell if it's not enough, that your gums bleed, or you have bad oral odor, or you have loosening of your teeth and things like that. So for those patients, or patients that are in nursing homes and unfortunately don't have access currently to dentists or to hygienists, I would recommend that they also, in addition to brushing and flossing, or complementary to that, to use oral rinses, specifically chlorhexidine mouth rinse and hydrogen peroxide. Those two things have shown to reduce the number of microbes in the mouth and potentially can help them reduce the potential risk of will reduce the risk of other infections, like you said, respiratory infections that sometimes the plaque can harbor. And then, in addition to that, if speaking of dentures, my grandmother, if there are any seniors or other patients that have dentures, removable dentures, that's another area that plaque can accumulate. And then during sleep, studies have shown that the plaque can dislodge and get aspirated into the lungs, and that can also increase the risk of pneumonia and other respiratory infections. So my recommendation to those people are to make sure they remove those dentures before they go to bed.
Absolutely. TheSuperDentist.com is the website. Thanks for joining us.
Thank you so much, and take care of yourself.
You too, Dr. Kami Haas. And so I guess I say we do it with no guilt, saying we'll skip that appointment, but at the very least, floss. All right, so we've got several things coming up, and the next one is a